This is the Pal Talk News Network.
The views expressed are solely those of the speaker and not necessarily those of paltalk.com, AVM Software, or its advertisers.
News Talk is online. News Talk Online is a production of paltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users. On demand on iTunes and on YouTube and on Blip TV and on my blog, GaryBaumgarten.com, where you're encouraged to post your comments, whether you agree with yours truly or not, no retribution. And thanks to our good friends at CRN Digital Talk Radio, we're syndicated to an additional 12 million households. I am your host, Gary Baumgarten. I welcome you to the show, and I remind you to go to paltalknewsnetwork.com, go early and go often, just like voting in Chicago, to see stories that you may not see, read, or hear in the mainstream media. One story that you will hear on the mainstream reports has to do with the health reform bill that was passed in the House last night. A debate and vote that lasted from 1 p.m. Eastern Time to about 11:30 Eastern Time. And we carried it all, gavel to gavel, every single word of it, gave folks opportunity to express themselves before, during, and after the vote here on the Pal Talk News Network. After 12 hours, I think, 12 and a half hours of constant coverage, my voice gave up and I said, good night, everybody, before I need a doctor. And but we're right back at it today because, you know, amazingly, in spite of the fact that this is probably, at least in my memory, the most reported on and most hotly debated bill that I can recall. It was over 2,000 pages long, almost 2,100 pages long, and people are still confused about what it will really mean to us. That's the important point. Well, we found somebody who I think will be able to answer most of your questions, so don't be afraid to step up to the plate and ask. Joining us today is Dr. Larry Levitt. He is a senior consultant in neurology emeritus at Lehigh Valley Hospital in beautiful Allentown, PA. Here to talk about how the law will affect the quality of patient care. The doctor is author of a new book, Uncommon Wisdom, which is a compilation of true stories from hospitals, part medical mystery, part human spirit. I understand it's a great read. I haven't seen it yet. Dr. Levitt, welcome to News Talk Online on the Pal Talk News Network.
Thank you very much. Happy to be here.
Glad to have you. And you do pronounce it Levitt, right?
Levitt is correct, yes.
All right, very good. So the basic question is, will this really result, when it finally takes effect in 4 years, in more people getting health care, people who today cannot because they are uninsured or underinsured?
Well, what can I say? We hope so. I think there is optimism that this is only a first step towards improving the healthcare system, and I'd have to say that I think what we've seen so far is really insurance reform rather than healthcare reform. But the hope is, and some of the positives are, that the number of uninsured will decrease from currently between 48 million and 52 million. There's some argument about that. That the insurance companies will no longer be allowed to prevent you from getting insurance if you have a, quote, pre-existing condition. In our family, we have a child with autism, and so the whole family is unable to get insurance because of that. That will be eliminated. Insurance companies will not be permitted to stop insurance because someone gets ill, which unfortunately has occurred. Apparently half of the bankruptcies in America are related to healthcare costs. So that's the good news. Other things that I wish were in the bill, if you want me to comment on that, is
absolutely.
aggressive tort reform. that is to reduce the cost and the burden on doctors and their families of malpractice suits. So there are things that are good about it. There are things that I wish were in it. I think it's the hope of many, including the AMA, which supported it, the American College of Physicians, which is the internist that supported it, the AARP, that this is only the beginning of a fix of the healthcare system, which just about everyone agrees is broken.
What I don't understand, Dr. Levitt, is if everyone is required under this new law to have some kind of health insurance, how can it be that there will still be people, based on the estimates that you just quoted, who will fall between the cracks?
Well, what I understand, again, and my information, a lot of it comes from the news media. And there was a summary article in CNN today. There was one in the New York Times. There was also a front page in the Wall Street Journal about what is going to happen, hopefully, with this. But the best estimate that I got is 32 million will be added to the insured. There are 48 to 52 million, so there are a significant number who are still not insured, and other advantages that are hopefully going to happen is that single employers, like my son-in-law, will be able to get insurance through what are called healthcare exchanges, etc. He can't join, a group at the moment because he only has one employee. That's him. So without being too personal about it, we are optimistic that this is the beginning of an improvement in a healthcare system that needs to be improved.
But as a medical practitioner, a physician, are you concerned, Dr. Levitt, about the reimbursements that, we already have very extensively looked at the reimbursements from Medicare, which many doctors feel are insufficient to cover coverage. Surely Medicaid, which is 60% of Medicare coverage typically in the various states, a lot of doctors and even hospitals, and now increasingly pharmacies, are not accepting additional Medicare patients because the reimbursement is too low. One of the concerns that was raised by the opposition to this bill was that the reimbursements to the doctors would be lower, and that would cause for there to be fewer people who are practicing, or people who won't accept some of the insurance that is proffered as a result of the new law. What are your thoughts about that?
Yeah, that's a very good question, Gary, and I share your concern. As far as Medicaid is concerned, a large number of people are going to be added to Medicaid, but the reimbursements for Medicaid are already very, very low, and many doctors do not take Medicaid patients because of that, and they see them in the clinic or they don't see them. Medicare reimbursements are not terrific right now, and they're going to get worse, such that at the moment a large percentage of doctors in New York City don't take Medicare. And so if you want to get care from these fine physicians, you have to pay for it. Put it on a credit card or pay cash. So the number of those doctors will probably go down further. So there's a problem with reimbursement, and you hit it right on the head. That needs to be addressed. You can't just put lots of people on Medicaid and expect them to be seen.